And so I want to thank you for joining us in this preview of the course. Every school of nursing wants their graduates to have the edge to develop beginning professional nurses who are contributing members of a team, which provides quality patient care safely. Today we're going to explore how your school of nursing or your hospital can provide a course which gives your new nursing students or beginning nurses the advantage they need to feel more confident and competent as they move from academia to employment. So we'll be talking about the problem, what precipitated my development of this course. We're going to present a solution, and we're going to talk about how we implement the solution. And then Liam is going to do a product demonstration, and we'll be exploring some questions which were frequently asked by participants who reviewed the course and also by others who have participated in a previous webinar. And then Jen will have some closing remarks as well. So let's get started, Jen, with the problem. So the research is replete with studies indicating that newly graduated nurses need to be supported during their transition to professional practice to successfully bridge the reality gap. A conundrum exists whereby nursing educators believe that students are appropriately educated for their role as bedside nurses. But in contrast, nurse employers say that newly graduated nurses fall short in confidently executing technical skills and in their ability to think critically and to clinically problem solve. So how can these perceptions be reconciled? A solution is found in the Transition to Nursing Practice Strengthening KSAs for Career Success course. It's an evidence-based bridge linking academia to employment. Next slide. Studies show a positive relationship between higher levels of stress and nursing error. Factors such as limited experience and increased turnover can negatively impact patient care. Also, not every acute care hospital provides a nurse residency program for their newly licensed nurses. That means that some new grads may not have the same opportunity to participate in a formal residency or transition to nursing practice. Next slide. Stephen Covey, in his book, 7 Habits of Highly Effective People, says that treat a man as he is, and he will remain as he is. Treat a man as he can be and should be, and he will become as he can and should be. Transition to nursing practice, strengthening KSAs for career success, challenges the student to think beyond the final exams that mark the end of school and to integrate concepts practiced and reviewed for NCLEX exam. The course immerses the students into the professional nurse role using evidence-based readings and resources to provide the foundation for thought and action. Course concepts focus on nurse-sensitive indicators, national patient safety goals, and patient care quality and safety while exposing them to think not as a student, but to think in their role as a professional nurse, treating them as they should be. So the assets include the comprehensive course, which encompasses the 10 modules, and the content is designed to be delivered online, and it's LMS compatible with Blackboard and Canvas, as well as it can be offered through Jones and Bartlett Navigate 2 system. The modules are conformed and have been normed to meet the CE requirements for 3 CEU per module, resulting in an offering of 27 to 30 CEUs, depending upon how the orientation is integrated. And the course is designed to complete within 8 to 12 weeks. There is, as we will be talking about later, an opportunity for the instructor to customize the course using the assets and to be able to deliver modules at various stages throughout the curriculum, should you choose not to use all 10 modules in one course, but rather to augment other course materials using the modules. Jen, next slide. These organizations, models, standards, and goals played a pivotal role in establishing the vision for transition to practice, and they also provide the framework for this course. So just at the time when the National Council of State Boards of Nursing initiated their model and shared their model for recommendations of nursing as nurses, new grad nurses transition to practice. The Commission on Collegiate Nursing Education was working to develop procedures for accrediting entry to practice nurse residency programs, and those two came shortly after the Institute of Medicine's landmark report on the future of nursing. So when looking at patient safety, I thought the best place to go for patient safety goals is, of course, the Joint Commission, and integrating the patient safety goals with the QS and competencies provide the framework for the course. So as you can see, it's highly organized around the evidence that instituted the initiative for transition to practice. Next slide. The curriculum is organized around 4 threads: leadership, patient condition, patient outcomes, and professional role. The concepts integrated in each one of those threads are linked to that particular thread, or to that particular concept, I'm sorry. The course was originally designed to meet the deliverables of the Department of Labor Workforce Grant. Since that time, there have been more than 600 participants engaged, and their experiences and feedback have contributed to the refinement of the course. So within the assets are activities, learning activities related to each one of these concepts that appear within the thread. So for instance, in leadership, there's management of patient care delivery and interdisciplinary communication and conflict management. And then with regard to the patient condition is managing the changing patient condition using simulation, physical assessment, and clinical reasoning. And then, of course, down in patient outcomes are the more on focused learning activities related to patient and family education, pain management, fall prevention, infection prevention, and then over in the professional role, end of life care and the role of the nurse in the end of life care and assuring quality end of life care, and cultural competence and management of their own stress and professional development, as well as how they can change their units with a keen eye toward alarm fatigue. So all these concepts play together in this curricular model, which is the transition to nursing practice. So next slide, Jen. So let's talk about how we do it, and taking a look at what are the online learning activities, and here are the list on the left of what would be covered in the course and in the curriculum, and many of them do relate to the national patient safety goals, and including in each of the learning activities are evidence-based readings. We don't use a book for this particular course. We use current research and evidence-based readings and resources. And there are assignments that link the theory or the concept to the readings, and those are the knowledge assignments, the Ks. And then there's a clinical application assignment for each learning activity, which is the application of the skills or the theory into practice. And then discussion topics, which present or give an opportunity to discuss attitudes and aptitudes about nursing and the particular concept. Now, these discussion topics can be used as discussion board topics, or they can be used as clinical conference topics. They're being used both ways as I'm consulting with different universities on how they're using this product. They're finding that it's useful in 2 ways. There are also quizzes established that relate to each of the learning activities and the resources and readings provided, and then finally a feedback assessment, which measures the quality of the core of the particular module as rated by the student. Did it meet the objective as it was set forth? And what was learned by the student? What was the takeaway? So the feedback assessment generates both qualitative and quantitative data, which can be used to support quality improvement and contribute to the program review process. So all resources are evidence-based, they're current, and they're dynamic. And what I mean by dynamic is that Jones and Bartlett has the ability to push updates out to each of the users or licensees. So the course is always up to date. It's difficult to use a book for this because the life of the book takes a little bit longer to generate new additions and updates. And so I think this is one of the strongest assets of this particular course, is that as things change in healthcare with regard to transition to practice and patient quality and safety, the users will be the first to know. So also, what I'm extremely proud of is the level of support that's generated through facilitator notes or video vignettes. Each of the learning activities has a description provided for the instructor or faculty member as to how they might want to integrate the concepts into their course, also additional links to references and key topics. So not only does it help facilitate the course, but it keeps consistency across the curriculum if you have multiple sections of the course and multiple instructors. So next, Jen. So how do we do it managing the patient condition using simulation? Well, comprehensive case studies are designed as pre-assessments. Students analyze the cases using a pre-established format, which links physical assessment findings to pathophysiology. Students commented that they felt the debriefing process for the case studies provided them with a valuable overall review of NCLEX. The case studies then serve as the profile for the simulated patient. We had an extraordinary opportunity to work with an aeronautical simulation specialist when we were developing these simulation scenarios. He attended every simulation over the course of the year and provided valuable suggestions on how to increase work and stress within the scenarios, pushing the students beyond their self-perceived limits within a safe environment. So included in the simulation assets are not only the comprehensive case studies, but debrief notes for the instructor or facilitator to use with regard to respiratory and cardiac conditions, and their patient charts, of course, and the simulation algorithms are available for the technicians to use to set up the simulations. And then we, in the past, when offering this, have used peer assessment forms where students evaluate each other on their performance within the simulation. And note that the simulations are modifiable should you choose to change them in any way. It's all modifiable. So the case studies focus on both respiratory and cardiac, the most common diagnoses or comorbidities for patients admitted to the hospital, and provide facilitator notes, resources, and references that can be used for debriefing. So next, Jen. So for professional development, this is really a fun thing for me to develop, and it was called leadership coaching, and it's an opportunity to bring together key nurses and human resource personnel from the service setting to participate in on-campus student interviews. And the process developed for this activity was fun. It built academic and service partnerships and provided the students with the feeling of participating in high-stakes interviews within a safe setting. This activity, along with the simulations, are consistently rated as favorites by students. I also wanted to mention that these modules can be used for continuing education. So if I'm speaking of professional role, should you have beginner nurses that are employed in your hospital and you'd like them to experience more information on patient safety and quality of care, they have been normed for 3 CEU per module, which can generate 27 to 30 CEU, as I had mentioned before. The clinical leadership vignettes were practice scenarios which focused on ethical dilemmas, and the vignettes were generated from past participant experience, which increases their relevance to the new participants. So as they encountered situations, they would come back to us as faculty, as their faculty mentors, and share the situation or share it in our clinical groups and be able to work through the ethics of the decision making. And so we've accumulated those into these clinical leadership vignettes. So they can be used as clinical conference topics, as leadership topics. There are multiple uses for these particular areas for review. So Jen? How do we do it? Foundation documents. Oh my gosh. When creating this course, I thought, golly, if we can just give whoever purchases this everything, that would be awesome, and then they could use whatever it is that they would like to incorporate into their program, or use whatever assessments they already have, or use the assessments that we have used in this course before. And so included in these foundation documents are a sample syllabus, the reflective journal, we get a glance, so the course is organized on a weekly basis and how it relates to the assignments and all the links, and a clinical login checklist for accountability for the students. But the two things that I think are most helpful are the transition to practice program learning activity by key element chart. And it illustrates the relationship between each learning activity by key element, the CCNE Baccalaureate Essentials and the QSIN competencies, which helps support program evaluation and documentation. Also, in working with universities as they're onboarding this course, it was kind of confusing at first as to how the course lays out. So I've included a content integration map, which is helpful to be used to facilitate the organization of the assets within your own learning management system. And again, I wanted to highlight that all facilitator notes are available, and all forms and documents are available and are downloaded if they're for student use. Okay, next, Jen. It's Liam's turn. Hi, Liam. Will you provide us with a demonstration, a peek into the course?
Yes, I can definitely do that, Sue. One moment while I just pull up the course to share with you. And while we're just waiting for the course to pull up, another thing, Sue had mentioned this before, what I'm going to show you right now is the course within our Navigate to platform, but I want to mention that we will have a cartridge for Blackboard and Canvas as well, and we could potentially take a look in other LMSs, but currently it's set up in Blackboard and Canvas, and it's going to be laid out very similar to what I'm showing you right now. So this right here, what you're seeing is Navigate to, so this is our platform. We have pre-built this course for you, so it's going to come with the 10 modules that Sue had mentioned. And then we also have the assessment section, which will have a lot of surveys that are available to you. We have the comprehensive case studies that are available to use, as well as the simulations that you have the option to use. And we have the reflective journal section that's available for you to use as well. So if we come up, I want to give you an example of what we pre-built into a module. So within each module, we'll have learning activities. So if we come over and open this up, this is really going to walk the students through what they need to do within the module. So if we come over here, it's going to give them an introduction. So it's going to introduce them to the module. It goes through the outcomes. So they're going to go through and know what they're going to learn and what they should learn as they go through this module. And then with the organization, and you'll find that each module is going to be organized in the same way. It's going to go through the assigned readings, which we have down here that they need to go through, required and recommended, the resources that we have available, so additional resources they can go through. And then we have the discussion board questions, which we've built into the course for you. But we have the discussion board questions here, along with the knowledge assignments and clinical application assignment that we've added within the course. Once again, those are built into the course, so those are pre-created for you. And then if we go over here, each module will have multiple pages. The feedback assessment, this will then go over the survey that will be available for the students. And once again, this is also available to be built directly within the course. And then references for the students. So if we come back to the course, and we go down the module, you'll see each module will have facilitator notes. So as Sue mentioned, this is designed to help you as the instructor teach the course. So it's going to give you tips and walk you through what you need to do. Down here within the module is a quiz section. This is where you're going to have access to the quiz that we created. And these are pre-created for you, built into the course. Feedback assessment. This is the survey that I had showed you within the learning activity. So if you come over here, you can preview it. and this is the survey, and this will automatically go in and report, and you'll be able to go through each survey and get the results of your students. And then once again, we have the discussion board questions that we've added in to the course for students to go through, and the clinical application assignment and the knowledge assignments where applicable. These are all pre-built, but if you want to go in, you want to edit any of the questions on the quiz or the survey questions, or you want to add survey questions, you can certainly do that, whether it's within our platform or once you get it within Blackboard or Canvas, you can edit it however you need to. Same goes if you need to hide certain modules within the course, you can do that. These are rearrangeable. They can be hidden very easily. So anything that's grayed out when you hide it, that means it's not visible to students, but you still have access to it. So if you only teach or need to use a couple of these modules, you can very easily do that. Down here, once again, if we open up the case studies, you'll see each case study will have the facilitator notes. So the facilitator notes in the case studies are just like the student worksheets, but it has instruction notes for instructors that we've added into it to help you walk the students through the case studies. Under simulations, this is currently hidden from students. This is more for instructors to use so they can go in and they could set up the simulation. So it has all the information you need for the 2 simulations that we've added in. And then once again, we've added in the reflective journal. So anything you see here that's grayed out, these are just for you as the facilitator. And then, it's going to give you more information as to, what you need to do with that. And then if you want to make some more customization, so I kind of quickly show you how you can hide items just by hitting the hide button, but you do have the ability to add in your own topic. So if we come down here and hit this plus button, you do have the ability to add in your own topic. So if you want to add in more content than what we have in the course, you can very easily do that. If you want to come over here and maybe add in a syllabus or course schedule, you can very easily do that. So there's drag and drop. All you have to do is come over here and you can drag and drop it. So, maybe you're not using the Getting It Started module, you want to move it to the end of the course, you can do that. This pencil icon will allow you to come over here and you can name any topic that's in here. You can also come over and rename any topic that we already have in here as well. So all of this is customizable. You can set it up how you need it. Once again, once you get into Blackboard or Canvas, you can customize it. You can hide, remove, add in whatever content you need. So this was a brief overview of transition to nursing practice. But if you'd like a personal demo of the course to get more information or would like a trial, please reach out to your account manager and we can set that up for you.
Great, thanks, Liam. We're going to transition back into the slide deck, so just give me a few minutes till we get back there. And everyone should see the PowerPoint slides again. Liam, can you see my screen?
Yes.
Okay, great. So I'm going to turn it back over to Sue to talk a little bit about why you really want to adopt this course.
Yeah, so as a faculty member, I thought, now, why would I want to encourage you to take a look at this course and see if it's useful to you? And I wanted to make the course as simple as possible. While Liam was showing you how the course can be customizable, it may have, been perceived as like, oh my gosh, there's just so much to do here. But it is simple with the concept integration map and also with the support of Jones and Bartlett and people like Liam who can help you with the integration of the content. It does create simplicity in the course. One of the most important things is that it's evidence-based and that the materials are current or classical. And as things change in the healthcare arena, some of the resources might change, some of the readings might change, some of the applications might change. So as they change, they would be pushed out to you so you can integrate them into your system. The course is comprehensive, and it really does address things that new nurses need to know with regard to nurse performance indicators, where their responsibility lies with the patient with quality and safety, and how that all interfaces with accreditation. and helps them to become included in the organization as they're going through the course. Again, it focuses on patient care quality and safety, which is the utmost important. I'm very proud of the instructor support, and have given a lot of thought to those documents that I've included in there and suggestions for how content can be used. And again, they're only suggestions, they're not mandated, but it hopefully will provide a level of comfort for an instructor who's using this course for the first time. And it's been tried by more than 600 users through the grant that originally precipitated its development. We've used the feedback from those users to increase the quality of the course. And what is really cool about this, and what happened when we piloted it with the university last year, is that it provided a stronger foundation for collaboration between that university and its clinical partners. And the clinical partners could see the value of this course in transitioning students into their employment pool, and could note that there would be some benefits associated with that, and I'll share those with you in just a minute. And we talked about the dynamic nature of the course, that it is updated on demand, and it's versatile and customizable. I wanted you to be able to use it however it would be best leveraged for your curriculum. And also that there are outcome surveys that will be useful should you want to measure student success or the organization of the course, how it fits in with your curriculum, or to be used as supporting documentation for program evaluation. So Jen, let's see what's next. So who might want to use this? So I have a strong philosophy that if you develop one really good course, that it can be used by different entities. And of course, schools of nursing would benefit from this a great deal, ADN and BSN programs, and also RN to BSN programs. It's been used as a RN refresher course for people who have been out of practice for 3 to 5 years or more and who want to come back to the acute care setting, or as you have RNs enrolling in your RN to BSN programs, it's a good foundational course for them to take. In the past, we've used it for international nurses who are coming into practice in the United States and need to know a little bit more about the healthcare system as best as we can figure it out, and to be able to help them get a strong foundation with regard to patient quality and safety. Nurse employers who've used this course as an adjunct or as part of their transition to practice or nurse residency, it does provide a great foundation that attends to things that they're measuring with regard to performance and reporting with regard to their performance. And then I think there's also application for nurse recruitment companies who want to make sure that their nurses whom they're distributing or helping find jobs or recruiting for temporary employment have a good, strong foundation in quality and safety of patient care. So let's see what they're saying, Jen. So Sandra Farmer shared with us that she was able to get in to review the course online and that she loved it. She really liked that the students can click on the links for the readings and resources, and it's all right there for them. And she thought it was very well developed, and she's anxious to explore it more. Thank you, Sandra. I think she's on the line with us right now. Next. The employers that we used when the course was used for the grant really felt strongly that because of their participation in the program, they were anticipating significant decreases in new grad recruitment costs, because the senior nursing student would then come in as a new grad, but they would already be integrated into the organization, and the clinical application assignments ask them for a deeper level of integration by having these activities with ancillary departments and staff. And they already know the electronic medical record, and they know people, and they know develop the network. And they're also anticipated that there would be a decrease in new grad transition costs for those reasons as well, and also an increase in new grad retention rates. And where that statement comes from is the fact that the course, when combined with clinical experience, allows for the potential employer to have an authentic assessment of the student's performance and their attitude and their aptitude and their ability to mesh with the team on the unit that they're working with. And so knowing that, and also knowing that the preceptors are understanding that these students might become their colleagues, they find that there is a more open approach to receiving these students. And as they are received, welcomed, and received warmly, they tend to stay employed or seek employment through that particular organization. So I think this program, should it be used in a relationship between academia and service, that would be outcome, that there would be an increase in new grad retention rates. Yeah, let's go on to the next one. So what did one of our students say? She said that the program had immensely increased her confidence through broad-based learning activities, and she goes on to list them. And because of the program, she felt that she can survive in any hospital setting. I like that word, survive, and reach her maximum potential to be the best nurse that she could be. And she had increased confidence and feeling of competence as she began her first steps in her career. So that was really positive feedback from her. Jen? So when we first thought about Jones and Bartlett partnering in this course, when I first thought about that, the course was sent out for peer review. And so some of these questions in this frequently asked question area come from that review, and some come from conferences that we've attended and things. So I'm just going to highlight the ones that are most commonly asked. And that is, can this product be incorporated in schools with CCNE accreditation? And of course it can. The alignment document that I discussed with you that's included that matches the learning activity with CCNE essentials documents, and also the Qs and competencies is really helpful and illustrates that. Jen? So how many class hours are used for online learning activities? So when we were using this for some continuing education, there was a norming process, and so each of the participants responded to how much time it took for them to conclude and to engage and conclude in the activity. And so each of the learning activities, or modules, as you might call them, have been normed to 3 class hours per learning activity. That's to include the readings, the knowledge assignment, and the clinical application summary. There's generally a summary required of the clinical application. So 3 hours is spent. You can anticipate 3 hours for each learning activity. Jen? Can the product be used in collaboration between schools of nursing and their clinical partners? I give a strong yes to this. The organization of this course is based upon feedback from clinical partners and what they need. And then there's an opportunity to meet with them. And I have established a model which I can share with you, which proved to be very successful in the arena of Department of Labor workforce grants. And I'd be delighted to share that with you and to talk about how this partnership, such a partnership, could be optimized. Hey, Jen? And can the product be used by hospitals as a component of a newly licensed nurse residency program? And yes, of course it can. And the content focuses on patient safety and professional development. And the framework does with residency accreditation standards. So it's that in collaboration with a School of Nursing, I'm speaking to the hospital people who might be on the phone. If you were to use it in collaboration with the School of Nursing, it could be possibly accredited with all the other standards that have to be included. Okay, next. And what competencies are practiced in the simulations? Oh my. We focus primarily on effective interpersonal communication, leadership skills, and also incorporating standardized communication. I had spoken with John Nance at great length, and he's the author of Why Hospitals Should Fly, and talking about the importance of standardized communication in aviation and how aviation is now one of the safest industries, and why we should be looking at standardized communication and also checklists when working with within the healthcare environment. So standardized communication, SBAR, is included in this. Teamwork and leadership are essential to be successful in the simulations, and also managing patient and family dynamics. The professional accountability, and also review clinical decision making through the debriefing processes. Next one. How might participation in this course benefit nurse employers? So as I alluded to before, previous nurse employers had indicated that they're anticipating a decrease in onboarding time and expense, and that the students know the unit culture, and they have established a network with the personnel, and they know the electronic medical record system, and they know policies and procedures, and if they don't know them, they know where to find them. And it provides the employer an opportunity to authentically assess the students as potential employees, and also gives the student an opportunity to see if they're a good fit, because they want to have the best outcome too for their first job. So it's a great time to do that. Jen? One comment was, and I found this to be very appropriate, is that this content appears to duplicate concepts already presented within the curriculum. I'd say yes, it should, because all curricula should include the National Council State Boards of Nursing, CCNE, and CUSN initiatives, the concepts presented by those, and also take a look at the Joint Commission recommended concepts that speak to patient safety and quality of care. And students need to be exposed to this time and time and time again. So I was very happy when this question came up, and it says it appears to be a duplicate of concepts. I go, yay, I'm successful in creating this program, because we want the students to have exposure to this in a safe environment, to have the feedback that increases their confidence and help them to become more employable, so they can demonstrate great critical thinking skills and also patient problem solving skills as well. So yes, it should be familiar to the students. And next. How does this benefit schools of nursing? I think one of the best outcomes is it encourages collaboration with clinical partners. And in the pilot that we did last year between a School of Nursing, their clinical partners, the clinical partners increased the number of placements for students. And we know that that's a very dynamic and also competitive situation. And so that was one of the real positive outcomes of this program. And it provides a comprehensive employment-driven approach to the senior practicum, and it immerses the student in the clinical environment and has a strong focus on quality and safety. Also, the facilitator instructor support minimizes challenges and promotes consistency across the curriculum with multiple sections. The course is easy to incorporate, and there's a lot of support, a great deal of support on the part of Jones and Bartlett to help schools of nursing or hospitals be successful with its use. And then the outcome data that's generated through the feedback assessments and quizzes and the responses of students on how they integrate the content into their practice is great for program evaluation and to support the program evaluation documentation that's required. And lastly, I'm turning it back to Jen.
Excellent. Thanks so much, Sue. Great presentation, and thank you to Liam for walking us through the course. So before we get to the Q&A, just a quick reminder, if you have any questions, we will take them live. We have a few minutes to do so. You can find my name, and that's in the panel on the right-hand side of your screen. and you can message me directly and we can get these questions going. But in the meantime, if you would like to request a free trial, we do ask that you fill out the form that's located at go.jblearning.com/TTP trial. And we also welcome you to download the case study that has a lot of great outcomes data that talks a little bit about the pilot study, which drove the creation of this course. And if you'd like to find your account manager to talk to them a little bit more about this course and even to set up a more in-depth product demo if you're interested in seeing the course a little bit more before you adopt or go with the trial, please feel free to reach out to your account manager as well. And we will share these links in the follow-up email as well too. So I'm just going to check to see if we have any questions here, and we do. And Sue, a couple questions here. How many simulations do we have set up in the course? And secondarily, how easy are the assignments to grade?
The simulation, we have 3 simulations. Let me back up. There are 2 simulation concepts. One is respiratory and one is cardiac, with 3 simulations each. And they can be modified if you choose to focus on something else that you're teaching in your course that you would like to add to the simulation. They can certainly be done. So you should have access to a total of 6 simulations focusing on cardiac and respiratory. And then, Jen, what was the next question?
How easy are the assignments to grade?
So the assignments are not APA papers, but reflect in a short period of time, usually 2 or 3 paragraphs, what the student is thinking. And I do include a writing assessment rubric, but you could use your own rubric as to how you would like to assess that. Nothing is longer than 3 paragraphs. And actually, I encourage the students to use abbreviated communication like bullet points, because they need to practice getting the concept conveyed in short sentences, either by speaking or by writing. So they should not be difficult to grade at all. I've used this course only as pass-fail, but there is a way to assign points to each of the assignments where you could use it for graded activities.
Thanks, Sue. A couple other questions. What impact does it have on NCLEX, or is this more for clinical practice?
The outcome of this course has not been measured on NCLEX. It's just been with student comments on the importance that the debriefing has provided for them, the opportunity to explore the patients in the simulations with greater depth. And I'll share with you, when we were using this course for the grant and also in the pilot, I had working with me 2 critical care nurses who are also nursing faculty, and they were the ones who debriefed the course. And so the student would complete the comprehensive case studies, come in as a group, and it would be like firing coaching questions, facilitating questions, and then what, and then what, and then what did you do? What's wrong with that? How could that change? How can you think about this differently? And so that they really provided strong feedback with regard to feeling like they were becoming NCLEX prepped. But I cannot say anything about outcome data with regard to their performance on NCLEX. And what was the second part of that question, Jen?
Asking if it's more for clinical practice.
It's to develop professional role. We really want these students to become nurses who have a strong attention to quality and safety with regard to patient care. Just about everything we do is built upon beginner's novice to expert. So as they're becoming more experienced in their role as advanced beginners in their senior term or senior semester, they move into novice as they progress into employment. So what we want to do is to give them as strong a foundation to build the confidence to move into that first role of professional nurse. So it's developing their professionalism, their ethics, and their abilities to think and to process information and come up with decision making. So I don't know if you can say that that's for NCLEX or if that's for clinical. I'd say it's for professional nursing.
Thanks, Sue. A couple questions for Liam, and I know that we did have a couple questions on pricing, so I can address that. The price is per student for usage of the course for the activation code. It's $149.95. And Liam, we are getting a couple questions regarding does it work with D2L? And do you happen to know the length of time that the student will have access to the course after they activate their code?
Certainly, I can help answer that question. In terms of D2L, that's something we can take a look at and see if we can get a cartridge set up to where it will work with D2L. So we'll have to get back to you on that. But that's something we can certainly look at. In terms of length of time, that will depend. So in terms of the Navigate, if you were to use it through Navigate 2, when you redeem an access code, it would be 365 days from when you got access to the course, whether it was purchased digitally or redeemed an access code. If you were using this in your own platform, then that would be up to you. Once students have access to it, you would be able to control how long they have access to the course.
Thank you. Another question for you, Sue, is could this core be used to replace the nursing leadership course?
I'm always reluctant to say replace because I'm not quite sure how nursing leadership core plays out. It certainly has a strong leadership component because I think we need to build leadership throughout the nursing curriculum, and this does culminate with a strong leadership component. So I would be reluctant to say, oh yes, just throw out what you have and adopt it. But I do believe there is probably a great deal of pertinent information that could strengthen what you already have or serve as a foundation if you wanted to build upon it.
Another faculty is asking if you're going back to employers and students 1 year out after they've taken the course and they've been in practice to see how successful the course has been for them.
Yeah, we have that grant information available in the, I believe in the case study. We had outstanding results with retention over 1 year. The grant, the Department of Labor Workforce Grant, required that as an outcome measure, and we had the courses run through two different program managers. But when it was managed by the Hospital Association, the retention of those participants for 1 year was at 98%, and that's retained within the hospital. They may have moved from one unit to another, but they were still working at that hospital at 98%. Then the course moved into a university setting and was offered through program outreach. And so we had participants in there who were nurses coming back to practice, who also knew grad nurses and international nurses. And that variety of constituency dropped the retention rate to, I think it was 89 or 92%. It says in the report, and the reason cited for that was that sometimes the people coming back to practice felt that they were overwhelmed in the clinical situation, and also the international nurses felt somewhat that way too. So we're looking for ways of supporting them with a little stronger clinical activity and more mentoring and preceptorship, because there's an assumption that because you're licensed and have been licensed for 5 or 10 years, when you come back to acute care practice, you should be up and ready to go fairly quickly. Well, there is a learning curve, and sometimes that's a little steeper for some than others. So the retention rates, I feel, were very good. Department of Labor was ecstatic when they first released their money. They were anticipating a 50% retention rate. And when we came in with that 98% after the first year, we were granted subsequent years of funding for this particular initiative for the state.
Great. Thanks, Sue. We have a comment and a question from another nursing faculty. He's saying, with the faculty workload, I think this course is excellent. Do you think a course like this would be useful for new faculty since it shows the importance of alignment to the essentials?
Oh, I love a question like that. As a curriculum developer, I like the word alignment. I'm currently working with a university who's adopted this and who are using or have incorporated clinical faculty as their clinical faculty, clinical nurses as clinical faculty. I'm sorry, I didn't say that clearly. And I'm working with them in this course because they're responsible for the clinical application and the clinical supervision, and they work in tandem with their course coordinator. And so the instructor support that's available to them, and then I also did a orientation to them to the course, and then link them with their faculty of record or their clinic or their course coordinator. Has been a really solid relationship. So what we're looking for with that particular launch is to see if the university can retain these clinical experts as clinical faculty by using this course that both entities, the clinical faculty and the course leader, has the shared relationship of supervising the students.
Thanks for that, Sue. And we have one last question. And actually, let me just double check that. But we'll have Liam, if you could answer this question. It comes from someone who is working in a non-academic environment, I believe, and wanting to know if our product would be somehow compatible with their LMS called HealthStream.
Off the top of my head, I'm not familiar with that, so I wouldn't be able to say if it would be compatible with it, but that's something we can, we would be able to take a look at.
Okay, great. Thanks, Liam. Well, I want to thank everyone for joining us today. That's about all the questions that we have. As we've mentioned before, this session has been recorded and it will be available on our YouTube channel, and you'll be receiving a follow-up email from us just with a few of the links we mentioned, a link to fill out the form so that you can, if you're interested, fill out the form for the trial. You can download the case study, and there's also a link for where you will be able to find the recording on YouTube, and that should be available in about 1 to 2 business days. I'd also like to extend a very big thank you to both Susan Ullrich and Liam for joining us today, and we hope to see you at a future Jones & Bartlett Learning Nursing webinar. Thanks, everyone. Have a great day.